Hi Jim, we're going to go over some tests today. Your first test is an anion gap AG test. The normal range is 4 to 12 equivalents per liter. This test can identify the causes of acidosis as it evaluates the acid imbalances. Medication and dehydration are a factor. Nausea, vomiting, and diarrhea would be would increase. Decrease would be fatigue, irregular heartbeat, decreased sodium levels. A nurse will explain the purpose of the test, and after the test, they will go over the results and modify the care if it's necessary. Calcium, normal range is 8.8 to 10.2. This is to determine the fluid balance in the nerve and muscle function. Parathyroid levels, they try the calcium intake. Hyperthyroidism in cancer. Decreased calcium levels are generally caused by hypovolemia. High calcium levels can lead to arrhythmia, impossibility, coma, and calcium levels can convulsions and tetany. A nurse will explain the procedure and encourage the patient to relax and not to take any sample supplements for 8 to 12 hours. A 5 milliliter venous blood will be collected in a serum separator tube. Post instructions results should be explained. The patient should resume the normal activities monitored in calcium normalities. Chloride, 96 to 106 equivalents per liter, to work with the sodium and be able to maintain the fluid balance and the acid balance from certain drugs can alter chloride levels. Dehydration, Cushing syndrome, and hypertension will increase. A decrease could be severe vomiting, diabetes, head injuries. A nurse will explain what the purpose in the blood collection procedure. Post instructions: a nurse will have the patient resume normal activities and diet. Someone will review the results and report recording findings as the nursing plan says they need. Magnesium, 1.8 to 2.6 equivalents. This is to involve the muscle and the nerve function and emphysema activity. Magnesium levels could be normal even if the body stores depleted to about 20%. Factors could lead to decreased levels such as tremendous seizures and muscle cramps, and implications could be too little calcium can lead to tetany, too much calcium can lead to depression, nausea, vomiting, and fatigue. A patient should fast for 4 hours prior to the test, and someone will review the results and report findings and recordings. Phosphate, about 2.7 to 4.5 milligrams. This will determine the energy production of bone health and acid-bases balances. Drugs, lactives, and seasonal variations. Renal and insufficiency, hypocemia, bone tumors, and metastasis. Rickets and liver disease and alcoholism can be could decrease the levels. A nurse will explain the procedure and should fast prior to the test. Nurse will obtain fasting samples and the SST or red topped tube, observing a standard precautions. Potassium, normal range should be 3.5 to 5 equivalents. Factors could be like kidney disease, excessive potassium, an intake of acidosis, vomiting and diarrhea, and implications could be hypokalemia. The nurse will explain the purpose of the procedure. Internal interventions: a nurse will collect a 5 milliliter sample using serum and hypertension in a vacutainer tube. And then the nurse will help the patient resume normal activities. We'll also monitor the patients appropriately for like calcium and oximetries. And the sodium, 135 to 145 equivalent per liter. Factors can lead to dehydration, sodium intake, diarrhea. Factors decrease excessive water intake, kidney disease. Implications could be hypodermia. A nurse will explain the procedure. A nurse will obtain 5 milliliter sample in an SST or red topped tube to avoid hemolysis. The results will be explained to the patient, may be monitored for fluid, sodium imbalances, modify nursing care if it's necessary. That's it.